Straightsmile Solutions, straightsmilesolutions.com, and the question today that came to me was, is it easier to do a peg lateral case in braces or Invisalign clear aligners? And of course that really depends on how you're going to manage them and what your restorative option is going to be afterwards. Remember, most peg lateral cases, unless it is a class 2 patient with overjet, like a mild to moderate class 2, and unless you are not planning to restore it and you have a slight class 2, in that case you can just smash all the spaces up and you're done. If you're fine with leaving itty bitty little teeth, they run in my family. That's what they did with I won't say who some family members who had braces. They didn't even, I don't remember them giving me or my siblings an option to restore. We were all slight class 2. They just smashed up the spaces. Definitely never came up. I was 17, 18. It never came up as a discussion for me. They just smashed all the spaces together. I kind of wish they had given me the option to restore them, because now I have overjet and peg laterals. But in any case, first of all, let's talk about what causes a peg lateral and what the repercussions are. Usually it's genetics, and you can measure the discrepancy. It's called a Bolton discrepancy, assuming the patient is class 1. You can measure it. It's really easy to measure in either ClearCorrect or Invisalign. Back in the olden days when we only had braces, we would just guess and check. I think there's a Bolton. We'll see what happens at the end. Once we get everything class 1, we'll see where the bite goes. We might have to restore these. We might have to do some lower IPR. Nowadays, you can just toss the case in the Clincheck or even in ClearCorrect, and it'll boom tell you exactly how much your Bolton discrepancy is, assuming the case is class 1. Like I said, if the case is slight class 2, who cares? It probably isn't a big deal. If the case is class 3, it's a much bigger deal. So in terms of braces, I mean, usually, unless they're like super peggy, usually the bracket stays on and it's not a problem. However, the space management is a bit of a pain in the butt, because you have to use a combination of open coil springs and closed coil springs to shimmy the teeth around to make sure you have the right space. This is usually how I like to place them, with a little bit on the mesial and more on the distal. Some people like it all on the distal. Some people like it 50-50, more like this. So it really just depends. You have to talk to your lab, and a lot of times orthodontists aren't the ones that are doing the restorations. We just do what the GP tells us to do. They want it like this, they want it like this. I don't care how you want it. How do you want the gum line? Up, down, how do you want it? So back in the olden days with braces, we would have to kind of get the verbal information, overjet, overbite, gum line, space positioning, and all planes of space, and then we'd try to do it, and then we'd send the patient back to the doctor to check it and make sure it was good before we debonded, made a temporary retainer. Then they get it restored, then we make a new retainer. That's pretty much how the workflow worked. It was a lot of back and forth, right? That was before there was digital photos and emails and everything like that. And of course, now that you have Invisalign, it's so much easier. And I'm using Invisalign as a generic term, which is clear aligners, because you can just send them the Clin Check. Hey, are you good with this? And with the in-face option, you can see it in their smile, you can see it in their gum lines, assuming you took the records properly, which is great, because then they could just digitally approve the treatment plan. I mean, we're doing them, but they can say, hey, yeah, this is good. You have a paper trail. I'm happy with this. And then boom, presto, it just happens. Now, to answer my own question, I think it's a lot easier in Invisalign, just the communication standpoint, also just the control, making sure the midlines are on with the face, everything like that. Only thing that can be a little tricky with Invisalign is if they're super tiny and peggy, you have to put regardless, you have to probably put a really big attachment on it, like a big chunky attachment. Sometimes, depending on the bite, I'll also put a chunky attachment on the lingual. Of course, it depends on the bite. We don't want them hitting on it unless you wanted an anterior bite turbo. Also, sometimes if they're super peggy, we have to build them up first a little bit, put some composite on them. Plus, they look kind of funky otherwise. But otherwise, yeah, definitely my preference would be, as you can tell, to do it in a clear aligner option, but not all patients want that. So now you know how it works. Definitely check out all my other videos on peg laterals and Bolton discrepancies. You can just go into my channel, which is Straightsmile Solutions, search by keyword, which is Bolton or peg lateral. I have tons of content on that. And as always, work with a restoring doctor or your lab if you are doing a veneer or a crown, because you need to know about overjet, overbite. If you're only doing I'm not saying only, there's nothing wrong with doing a composite if you're good at it, but probably the overjet, overbite is not as much of an issue if you're doing a composite, because you can use to stack it on the facial. But as you can tell, I'm no longer, haven't done restorations in 20 years. So things have probably changed a little bit. All right, thanks.